Today, we set a record for both the number of hospitalized COVID-19 patients and the number of COVID patients in the ICU. But the strain on our healthcare system is not only measured in hospital beds. We must also think about the people working in these hospitals. Their heroic work is saving lives, but it is also growing more and more difficult in the face of colleagues out sick or in quarantine because of intense community spread. Every region in Wisconsin has hospitals reporting current and imminent staffing shortages, and at least one region is reporting these shortages in a majority of their hospitals. Our public health system is also stretched beyond capacity. With our current surge, many of our local and tribal health departments are not able to keep up with contact tracing. We are supplementing their efforts at the state level, and we have just posted another hiring announcement for contact tracers, but it will take time before these new hires are in place and able to assist. So what does this all mean? It means our state is in a dangerous place. We are overwhelming our healthcare system. That is why we are announcing today, as the governor mentioned, that the alternate care facility in West Allis will open next Wednesday. We stood this facility up in the spring and have not needed to use it until now, so the next week will be spent readying it to begin receiving patients. The West Allis Alternate Care Facility will serve as an overflow facility for hospitals across the state, accepting patients who have tested positive for COVID-19, have been hospitalized for 48 hours, and are ambulatory. This will free up beds in our hospitals to better care for more severely ill COVID and non-COVID patients. The current surge in hospitalizations and the need for this alternate care facility is a direct result of the surge in cases we began to see in September. And our case counts today are even higher. Our 7-day average of new daily cases is 2,346, up from 879 1 month ago. To be clear, this is going to get worse before it gets better. Our current surge in cases will lead to even more hospitalizations, and we must prepare for that. We are one of only a few states in the country to need to open an alternate care facility. This is not a list we ever wanted to be on, but we are thankful to be prepared. However, we must each work as a state and as individuals to flatten the curve immediately. Please stay home. Wear a mask when you go out for the essentials. Stay 6 feet apart. Wash your hands frequently. Get your flu shot. And if you have symptoms or have been exposed to COVID-19, please get tested, quarantine, answer the call of the contact tracers, and assist them by providing full and truthful information. We're in crisis in Wisconsin. A crisis calls for drastic measures, and I'm calling on every single one of us to do all that we can to protect each other.